Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Right now, we are in the NICU of the new civil hospital Surat. Now here we have Dr. Apoorv Shah and his entire team. This team of nurses and Dr. Shah, their main job is to attend to the pediatric patient, the mothers who are positive and who are pregnant. Here, till now, 4 infants, 4 newborns had come in, out of which 3 recovered completely and 1 unfortunately could not be saved. To know what goes around here, their sad and happy stories, here is Dr. Shah over here. Dr. Saab, पहले आप बताइए, just explain me what sort of patients, COVID patients you get, the positive mothers, the children.
Okay, we are getting the children and neonates also. This is a neonatal ICU. Newborn is defined as 28 days of life. As of now, 33 mothers are delivered who are positive till date. But among them, all babies were negative, and we have successfully, still we have 7 babies here. So we have almost 26 babies we have discharged till now, and that is uneventful. Which are the 4 babies they delivered outside. They came here. Out of them, 1 baby was not recovered because patient was presented very late, and patient was in a severe dehydration, and patient was in a sepsis, that is an infection. So infection was very high by that child. Okay.
Doctor Sahab, ये बात बताइए कि that baby which could not survive, so was this complications because COVID complications, or was the comorbidities present since the birth?
We are seeing the hypernatremic dehydration. That is a common scenario in summer days. What happens in summer days? Patient get dehydrated because of the heat outside, and if they are not taking the feeding enough, they succumb to the vicious cycle. They are not getting the feeding. They do not get the proper energy. Because of not getting enough energy, they are still not getting the enough feeding from the mother. So that condition we call the hypernatremic dehydration, and the patient came in a severe dehydration and shock-like condition with metabolic acidosis in our terms. They have come late, so kidney damage was significantly there. So and baby was born full term, but his weight was very low. So according to the full term, baby's weight should be about 2.5, but baby's weight was 2 kg. So that can be the possible comorbidities and other factors contributed to the death.
Sir, it is very difficult to ascertain COVID symptoms in infants, in babies. So, what are the ways by which a mother can know that the baby might be showing COVID symptoms?
Very effective feeding, sign is poor feeding and lethargy. If baby is showing the poor feeding, not latching well, and not taking the enough feeding, and not sleeping, irritable child, then we can assess that child. A fever, hypothermia, that is temperature is low, runny nose, cough and cold are there, but not prominent in the newborn periods. Poor feeding and lethargy are the more prominent features.
Okay, so you have attended to many pregnant ladies who are COVID positive, but as you were saying, they deliver babies who are negative.
Yes.
So can you explain how is that possible?
First of all, we are testing the babies who are symptomatically positive. Almost there are the 2-3 factors. One is maternal to child transfer, because placenta is there, that is act like a barrier, so that does not. But during the birth process, if we are not taking care properly, then that could lead to the positive baby. After birth, we are taking the utmost care of the mother. We counseling the mother and father to what is the precautions we should. We are explaining them in their vernacular language age कि they should wear the mask, they should keep the social distance between them, they should keep the child in a same separate trolley, and they should breastfeeding but with mask. So that way we can reduce the positive ratio. Till date we have not get any inborn babies positive, and they have successfully recovered from here.
Okay, when these ladies deliver, obviously the baby needs to be breastfed and the baby cannot be kept away from the mother.
Yes.
In such circumstances, what steps can be taken to prevent that transmission of disease in the transmission of virus in the baby?
Counseling is the best effective way. We should counsel mother and father sincerity to we should explain that they should wear mask, they should keep their hands clean, they should does not use any ornaments or that thing that lead to transfer of the infection. Okay. They should keep the safe distancing of 6 feet if they are taking, and while breastfeeding they should wear the mask. That is the enough precautions. And we should also explain them the danger signs. If baby is not feeding well, if baby is not passing during their stool, if baby is looking too ectric, yellowish, jaundice, if baby is having fever or baby is looking dull, then they should report us to immediately. That danger signs we are explaining them very regular basis.
Sir, coming back to the baby who lost its life, okay, you put in a lot of effort, to try and save that baby. So, what all did you manage to, what efforts did go in that process to save the baby?
Okay. When we received any critical baby, we manage the baby according to the critical situation, and that is a protocol-wise management is there. So we have to resuscitate them by giving the oxygen, giving the fluids, giving them that drugs which increase the blood pressures also. We should giving them the antibiotics. So these are the general measures, and if by chance baby is stable, then we can add on the vitamins and other minerals that could increase the immunity power of the baby. But again, coming back to the expired baby, that could not save, because even after all efforts, we are giving the oxygen, ventilatory care, CPAP machine, antibiotics, IV fluids, inotropes, that is drugs which raise the BP, among bloods, PCV, and blood products. All that efforts were done, but the patient does not responded to, because patient presented very late. So that baby couldn't be survived.
So any message you would want to give to such people who have COVID babies, or who pose a threat right now, the infants, the parents?
Yes.
Any message?
Definitely. Surat Pediatric Surat Pediatric Association Charitable Trust, that is SPEC, that is our body that govern the all pediatric. That is a pediatric association. Okay. They have published one nice guideline, very good guidelines for the parents. General precautions. All people are aware that what precautions are need to taken. But few things I want to highlight prevents the accident among the children that lead to any accident that leads to the hospitalization of the unnecessary hospitalization during this critical time. Second thing, some drugs are not working in pediatric age group, so we have very limited resources for the drug we can give to the pediatric patients. So prevention is the better than cure. That is our ancient people said that. Okay, that is the only option we are, because also vaccination is not allowed below 18 years of age. So we have to take utmost care of the children, and outside traveling, and outside going that should be avoided in this critical time. We should keep the children away from the elderly people also, because in many times if the whole family is positive, then sometimes baby is also positive. They do not show the symptoms of the infection. They sometimes came negative for the rapid or RT-PCR negative, but still they are carriers of the infection. They can transmit to the elderly people, and they are the silent carriers. So we have to keep the elderly and children both away from each other. That's why we can prevent the infection and that.
Thank you, sir. So that was Dr. Shah. He was saying that prevention is definitely better than cure, and till there is any vaccination for the kids or infants, utmost precautions should be taken. So this was the story of the NICU ward, where all the babies, all the infants, all the pediatric cases are being attended and are recovering or have recovered. But one unfortunate incident, the one baby who could not be saved, remains the saddest incident over here in this building. With Shiva Devnath, this is Nazia for Mojo Story, Mumbai.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.